Hello and welcome to Sybil Wilkes Live. Yossi Media is proud to present Check In and Check Up on Your Health, a discussion on Black women and reproductive health in partnership with the American Heart Association. Uterine fibroids have interrupted the lives of millions of women, especially Black women, for centuries. While 70% of women have fibroids, 80% of Black women are diagnosed with fibroids earlier in life and suffer from the symptoms. Alarmingly, over 60% of those women will receive an unnecessary hysterectomy due to fibroid-related issues. In tonight's Check-In and Check-Up show, we'll discuss reproductive health and the effects of this illness on African American women, their families, and communities. Tonight's panel includes OBGYN Dr. Sonya Marks and fibroid survivor, producer and filmmaker Erica Taylor Davis, who will share her years-long journey with fibroids. And now, here's Sybil.
Hi, everyone, and welcome to Sybil Wilkes Live. I am Sybil Wilkes, and in partnership, as you heard, with the American Heart Association, we continue our effort to check in and check up for your health, for our health. And today we are discussing women's reproductive health and a look at the issue of uterine fibroids. Our guests today, as you heard, are our talented Spelman College alums. Spelman woman number one and mother of a Spelman woman, obstetrician gynecologist Dr. Sonya Marks of Atlanta, and the brilliant and brave Spelman woman who created, wrote, produced, directed, and is a survivor. And the documentary is Red Alert, The Fight Against Fibroids, my friend and former TJMS colleague, Erica Taylor Davis. Hello, ladies. Welcome, and thanks for joining us.
Thank you so much.
Yes. Hi, Sybil.
Hi there. So here we are to get information and to promote action on the topic of which many of us are familiar, but we don't talk about it as much. I mean, we're starting to more. I think this generation of ours has become more evolved in the conversation. There's no longer whispered hush tones about these kinds of things, but we especially don't talk about it as women. More as Black women, we may have that conversation, but thanks to landmarks like Erica's documentary, Red Alert, discussions and efforts are becoming a little bit more common. In addition to the documentary, we will discuss my fervent hope that this conversation will lift the veil of secrecy and information or some misinformation about women and fibroids. So, Dr. Marks, let me start with you on a very general question. First of all, and we talk about women's reproductive health. How early should we be having these conversations with our girls, with our daughters, with our nieces and friends?
I would say as early as possible. I guess typically it's thought that fibroids tend to occur in women when they are in their 30s or 40s. But in Black women, it's been shown that we tend to develop fibroids earlier. So approximately 25% of Black women develop fibroids by the age of 25. So you want to try to catch them earlier than that so that, if you have to intervene, that they can have the lesser treatments and not necessarily having to, automatically go for surgeries and things like that. So, I guess on average, we try to have women meet their OBGYNs at least by age 18. So, even in that first visit, you want them to go through their family history. So, if you have mom, your aunts, your sisters that have had issues with fibroids, then that's a good time then to go in and have that discussion. So at least you have them on the radar to watch and see if they're going to be at risk for developing fibroids also.
So the reason why I asked that, and Erica, I don't know if you had this, but when I started my cycle, I had a lot of pain, and my mother didn't understand it because she did not have that. But I experienced a lot of physical pain, and because my mother had a fibroid, which precipitated the need for a non-vaginal birth. It was a C-section with me because the fibroid blocked the vaginal section right there. So I went to an OBGYN for the first time when I was 14 so that they could do, because of my mother's history and wonder about me. Thank God I've never had that issue, but I did have the introduction to it at a relatively early age. And I don't know if that's always necessary, but my mother was very proactive that way in terms of trying to prevent, that situation happening for me. Erica, I don't know about you and when you were first confronted with the issue of fibroids.
Well, Sybil, it's amazing because I've had this conversation with other women who, explained to me that when they first got their cycles, they realized, after some time and after we opened up this discussion, that their cycles were a problem way back when they first started. When I think about it myself, I started when I was 11 years old,
Mm-hmm.
and my cycle was extremely heavy. And I didn't understand what a cramp was. You rely on the knowledge of your peers and your friends who know just as much as you do,
Right.
at the time. So, so that's, where the problem lies, is that we don't have that education early on. And so we definitely want to re-examine how early we're talking to girls about reproductive health and what can go wrong. Not just talk to them about their sexual health and what can go wrong there, but we want to also talk about what can go wrong with your cycle and the things that you need to look out for at an early age.
Yeah, and that early age thing is, right around there with me too. It was 11 or 12 in which I first began my cycle. So it was definitely an ongoing conversation in our house. Before we get too much further along in the conversation, Dr. Marks, let me ask you to just give us a definition of what fibroids are.
So, uterine fibroids are basically non-cancerous tumors that grow in the uterus. And, they can grow, I guess, in different locations in the uterus. So they can either be in the wall of the uterus, they can be inside the cavity of the uterus where, a pregnancy would develop, or they can be on the outside surface of the uterus.
And you say these are non-cancerous. So
Right.
for people who are experiencing some sort of challenge in terms of their health, can you talk about the difference between fibroids and cysts?
So fibroids are solid tumors. A cyst is more like a fluid-filled structure. So you can have cysts in the uterus. Probably more commonly we see them on the ovaries or the fallopian tubes, but they're more just like fluid-filled structures.
And you said fibroids are non-cancerous. Are cysts, can cysts be cancerous?
Cysts they definitely, you can have situations where you're more concerned about malignancy with certain type cysts. Yes.
Okay. So what causes fibroids? I talked about the fact that in my mother's case, she was concerned about it being a genetic situation. But there are other risk factors that are involved in this as well, correct?
Yes. So ask me the question again.
Okay, so the risk factors, what causes a fibroid?
What causes fibroids? So, I mean, that's part of the issue. We're not exactly sure what causes fibroids. And, so definitely there needs to be more research into that. As far as risk factors, our diet can play a part in that. So foods that are high dairy fat, red meat,
Alternate living. Okay.
processed foods, caffeine, alcohol. So,
Oh, great. I'm right in there. And yet I've got none of this.
So, those things in our diet can put us more at risk. Obesity is a risk factor.
Okay, keep going. You're right. You got me. Okay, I'm checking off all the boxes there.
Vitamin D deficiency, which is more common in Blacks, is another risk factor. And it's also been shown that, I guess, a greater overall lifetime exposure to stress.
Okay, all right.
Yeah.
Okay, so I take my
check
vitamin
a lot
D.
of the
I go out in the
boxes.
sun, but now you got stress onto it. Okay, once again,
Everything.
Right. We check a lot
Erica,
of the boxes.
I mean, like 9 out of 10. Hello, I'm
Yeah.
number one.
Yeah. Yeah. And and if I can add to that, Sybil, I talk with women all the time that reach out to me on social media, when I talk to them about my experience, and I tell them how I've altered my lifestyle as a result of learning more
I've seen
about
that. Yes.
fibroids. And, it's the doctor mentioned about diet. So I became vegan as a result of my fibroids. And we can talk more about that if you want. But,
I do.
okay, wonderful, wonderful. But also, I wanted to touch a little bit on the causes, the causality of fibroids. I've been speaking with research scientists out of Chicago, and they are in the documentary that I'm doing, and they are working on isolating the gene that's responsible for the mutation of fibroids growing into multiples and clusters, which we're finding that's happening more and more with women as they're being diagnosed and over the years. So they're working on isolating that gene, and hopefully, at some point within the realm of research that they will find out the actual cause of this. And that's my goal, is to find out the root cause.
Absolutely. And one of the great things about your documentary, which is called Red Alert, um, you also touch upon the fact that this particular issue is not given the kind of financial support that it requires. And is it because it is experienced so much by Black women, and that is the area where they just kind of push it off to the side?
You know, that's kind of, I think people are looking at that as like an opinionated reason, but I kind of feel like that's fact. We have enough case studies, we have enough decades, centuries of Black women suffering from fibroids, and it's only receiving such a small amount of funding for research and education. Right now we have the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021 out there, which is something that she started, prior to her passing,
Yeah.
many years ago,
Right.
and it still has not passed. And this is a bill that would give research and funding in excess of $150 million to fight for fibroid awareness, research, and education to different entities like National Institute of Health and other entities and private grant funding. So it's something that needs to be put on the forefront because there's so many women suffering from fibroids. 80% of African American women will have and be diagnosed with fibroids by age 50, whereas 70% of all women do have fibroids. Let's put that out there. But Black women suffer from fibroids the most, and we receive the worst symptoms, and will be diagnosed earlier, just as the doctor mentioned. We'll get that diagnosis earlier in life. So
Wow.
it's really important. Right now, I want to add that right now we are only funding fibroid research in the amount of $17 million. When you think about the number of women, the 171 million women worldwide suffering from fibroid tumors, it only gets the attention at $17 million. I mean, erectile dysfunction and
Oh my.
STDs
Yes.
get,
All
200 and
day.
some odd $million, but fibroids were at 17, and that's just unacceptable.
Dr. Marks, do you think that's because it's a female thing? Is it a female thing because we don't get the attention, or just a lack of exposure and information amongst those that are parceling out the money?
No, absolutely. I mean, just everything that Erica said is true. And then, as Black women, we're at that intersection of being women and being Black. So, we're going to get even less representation as far as, the clinical trials and the research and the funding. So definitely the lack of representation is damaging to science and health, basically because, it limits our ability to, consider, and investigate, things like uterine fibroids. So, definitely I think it's been shown to be crucial as far as why, issues like uterine fibroids don't get the attention that they deserve. So
we're going to continue our discussion about this. I want to give people an idea of what your heart project, Erica, of what you have been working on for a while, what you have been living with and working on, I should say. So check out, we have just a clip of your documentary, and that is called Red Alert.
Fibroid is a tumor of the wall of the uterus, by far the most common benign tumor in reproductive age women.
I come concerned about uterine fibroid research. Of the $27 billion that you have in your budget, only $5 million is being spent on uterine fibroid research.
He said, the pain that you're experiencing, they're contractions. They're called contractions. Your body thinks you're getting ready to give birth.
They did a vaginal sonogram and were able to tell that the fibroid was growing, and I was prescribed Vicodin during my first pregnancy for the pain. There was no concern at all, taking the medication and what that would do to my child.
Wow. Okay, so that is a clip from Erica's project. It is called Red Alert, the Fight Against Fibroids. And Erica, we're going to come back, take just a breather, if you will, and come back, and we're going to talk more about your journey, and as well as from the medical side with our guest, Dr. Sonya Marks, and my friend and the very creative and brave Erica Taylor Davis, and we will talk about this. So let's take a breath and remind people. See, I love that. And Yolanda is she's so excited now. People are actually doing what she says. Remind people that this is Check In and Check Up for Your Health, and in partnership with the American Heart Association. Today, we're talking about women's reproductive health and especially uterine fibroids with two of my friends, obstetrician and gynecologist, Dr. Sonya Marks of Atlanta, and also my former colleague and friend, and now the creative person behind this very powerful documentary, Red Alert, the Fight Against Fibroids, Erica Taylor Davis. And Erica, how did your fibroid journey begin?
My fibroid journey began, and as far as I know, it began in 2008 when I went to my OBGYN to get fitted for an IUD, which then they were kind of new on the market. They were the intrauterine device birth control device, where it's inserted into the uterus to prevent pregnancy, but also to slow down the bleeding, because I had been experiencing heavy cramping and bleeding and all of these symptoms of fibroids. And I was hoping that this intrauterine device would help with that. When she tried to insert the device, I screamed, and it was so painful. And she tried it twice and it didn't work. And at that point in time, the doctor says, well, some women just can't wear these devices. And there was just something inside of me that just did not want to accept that. Not that I wanted to wear the device.
And not that you
so
should
bad.
have.
Yeah. But just because something more was going on with my body. I just felt it. So I got a second opinion. And in that second opinion, she said, let's do a transvaginal sonogram, and which is another thing I had never heard of before. And she did the sonogram and found that I had 6 or 7 fibroid tumors. And I was completely shocked. I had never heard of fibroids. No one in my family had ever talked about fibroids. And so that began the fibroid journey, the 13-year fibroid journey that I've been on until today, up to today.
Dr. Marks, is that unusual that, I mean, that's why we go for second opinions, but when there is an issue like that, as with her first physician, she just said, well, this just may not be your thing. But listening to her body, that's really necessary, and pursuing that where others may not be as strong in search of an answer.
Well, it's hard to speak for, how other people manage, but, even, when Erica had concerns about heavy bleeding and pain, I mean, I would think that an ultrasound would have been done, at that point before even pursuing, the IUD. So, that is somewhat concerning. And, unfortunately, experiences like Erica aren't necessarily that uncommon, where, we come in with complaints or concerns and, they're kind of explained away. So, that can be an issue, unfortunately. And she did the right thing by, going and getting another opinion. I would, think she wouldn't have necessarily had to do that to begin with.
Not that she had come to you, I'm sure, Dr. Marks.
It would have been different.
Let me ask you, because Erica, you I don't know when you made the decision to go forth with the documentary and how it started, but and I've called you brave because it's one thing to tell the story, but it's another thing to tell your story inside of this. And these are real women like Erica, whose lives have been interrupted because of uterine fibroids. And as you mentioned, 70% of all women are affected by this, 80% of African American women today. What was that moment for you, Erica, where you decided, damn it, I got to tell the story and I got to make it my story and put it out there?
I love it when people ask me that question. It actually started with my first documentary. My production partner asked me to co-produce the film The Invisible Vegan about veganism in the Black community. And throughout that research and production process, I learned so much about about the connection between fibroids and meat, specifically red meat, like Dr. Marks mentioned. And after I learned that, we decided, let's put this story in the film. So I included my story in the film and talked about, the invasive surgery I had and, almost dying in the hospital. And, and so when the film came out 4 years later, women reached out to me on social media and said, thank you so much for sharing your story. Thank you so much for opening up this conversation because, it's a tabooed conversation. We know that in our community, the period conversation is a tabooed conversation. It's kind of a whispered hush conversation. So women were looking for this outlet to talk about this subject, and they were just suffering in silence at home. So, when women reached out to me, that was the first step of me deciding that I have to do something. I was trying to decide what was going to be my next project. So, it was that combined with my own struggle that I was continuously having. I had suffered 2 miscarriages as a result of fibroids. So, it's all of that. The combination of all of that is the reason why I decided that this film had to be done.
Mm-hmm. Yeah. And so obviously you got the response in the first documentary and going forward, was there any resistance amongst women telling their story, or was it kind of like a relief? Oh, thank God somebody wants to talk about it and hear my story.
Sybil, there was no shortage of women. When I opened up and told people what I was doing, or, looked just around the corner at friends that, told them that I was doing this documentary, people raised their hands. They were ready to interview. They were ready to talk about their story, whether they were currently going through it, had just been diagnosed, or had already had the hysterectomy. They wanted to talk. They wanted to share. They don't want other women to suffer like they had. So, I was really blessed to have the women that I do have in the documentary sharing these very intimate details about their bodies and about their lives, and how fibroids have transformed their lives in different ways. I'll put it like that. You have to watch the movie to know what I mean by
Yeah.
in different ways.
Yeah.
But the fibroid journey has transformed their lives, and I'm very thankful to all of them.
And thankful to you for bringing this fuller frontal, if you will, in terms of discussing this and making it not the taboo subject. Dr. Marks, let's talk about some of the treatments for this, because Erica has mentioned how going so far as hysterectomies and things like that. Some of the costs that are mentioned in the research here from Erica, the annual fibroid costs in the U.S. are calculated between $6 and over $34 billion. That's an unbelievable, and especially when you think about the paltry amount that is used, that is given for research. So let's talk about the treatments and what are the treatments available.
So, I guess, the treatment that people most commonly know is a hysterectomy. So, that's the definitive treatment because you're removing the uterus with the fibroid. So obviously that's not the ideal treatment for
Yeah.
many women because, once the uterus is removed, then that
All bets
eliminates,
are off.
right,
Yeah.
that eliminates the option for pregnancy. And even if, future fertility isn't necessarily a concern, it's still a major surgery with, significant risk of complications. So, that's, I guess, the top tier, definitive treatment. So I guess on the beginning end, we typically try to start with, you know, hormonal contraceptives. So either birth control pills or, like Erica talked about having a progestin IUD placed, and that's done to try to decrease heavy vaginal bleed or heavy bleeding from the fibroids. We have some other medications that we can give to try to shrink the fibroids. But typically those are just used in preparation for surgery
Mm.
or in women who are, close to menopause. And we're just trying to like buy them time, as far as their decreasing their symptoms until they naturally progress into menopause. And so with those medications, we only use them for approximately 3 to 6 months. And the reason for that is because they have side effects like hot flashes and menopausal symptoms. So we don't tend to use those for prolonged periods of time. And, I guess after those medications, then you have some lesser procedures. And I don't mean lesser because they're not necessarily effective, but just less invasive, in comparison to traditional surgery. So there's uterine
The less
artery.
invasive, the better. I'm just
Yes.
speaking on
Yeah. Right.
myself. Yeah.
Right. Absolutely. So, we have uterine artery embolization, or some people know it as uterine fibroid embolization. With that procedure, you go in and block the blood vessels that feed the fibroids
Hmm.
to get them to shrink. And, with that, you tend to have less symptoms from the fibroids. Uh, what's next? There's MRI guided focused ultrasound surgery. And so that's a procedure where, basically it's, in the MRI, but they use ultrasound waves to try to, destroy uh, the fibroids. So
Can
that's
I
a,
tell you the first look I got at fibroids, and I don't know why women like to do this,
mhm,
but after the procedure to remove the fibroids,
mhm,
and we've seen where a Delta doctor did this on an AKA, and they kind of stack them up
mhm,
and show you the range of size, and the size is often, I mean, it's like, whoa, that's,
mhm.
they can be quite big, or like pea size, marble size, that kind of thing. But
Right,
what it sometimes amazes you that all of these fibroids are in one little person.
right, right.
And so that makes me think that they start growing at an earlier age, or is it something about our hormones that make them grow faster, or is it what could that
Well, I
be?
mean, as Black women, it's thought that there is some genetic predisposition that we have that causes us to get them earlier and causes them to grow faster. Um, and so, like Erica said, there are studies being done to try to, flesh out that genetic component so that hopefully once we know what the cause is, then you can direct the treatments towards that gene and hopefully stop the process before it begins so that you're not developing the fibroids in the first place. So yeah, they can definitely get pretty large and cause significant issues as a result.
Let's just give a shout out to the American Heart Association, and especially our friend Arika Kason, as we talk about the American Heart Association and heart health, which is what they're concentrated on. But also, is there a correlation between our overall health or mental well being and fibroids? Is there any kind of connection there?
So yeah, so just like I mentioned earlier about stress. So basically, when we're in periods of stress, our brain tells our body to create extra hormones,
Hmm.
and so fibroid tumors are hormonally sensitive. So now you have these tumors that are in the presence of increased levels of hormones in your circulation, and that can stimulate and trigger them to grow. So
So if we're
absolutely.
doing something good in terms of promoting good heart health and for ourselves and for others, that can also help in the fight against these other issues people may have, such as fibroids.
Absolutely.
Good heart health could mean good reproductive health.
Mhm.
Yeah,
That's
and
a
Sybil, if I could add to that, with when you have fibroids, a lot of times you're anemic. If you
mm,
have, the bleeding issues, and anemia will wipe you out. It will, you'll have a lack of energy. You'll want to eat ice all the time, or some other things. You could develop pica, where you have a craving for things like ice, dirt, metal, crazy things.
Yeah,
I know
yeah, you've
Dr.
heard of it.
Marks.
Yeah.
Yeah. And so, when you think about just how you feel overall when you have fibroids, if you incorporate exercise into your daily regimen or into your weekly regimen, it does help you feel better overall. You feel very run down all the time. You're running back and forth to the bathroom, because, with the fibroid symptoms, there's frequent urination. Painful sexual intercourse is another symptom of fibroids. So if you're doing something to help your body move, help you to be more in shape, and like Dr. Marks mentioned earlier, obesity being a factor as well with fibroids, it doesn't help. It does help to move. Moving, your body definitely helps. Dropping some weight, if you're in the obese category, definitely helps with if you're a person with fibroids.
That is incredible. We're gonna take another breath and just give us a second to. There you go. There you go. And as we come into this final segment of our program today, I want to take a quick question. I know we have questions from the audience. I want to thank people for joining us today as we check in and check up for our health. And as you have seen, having great conversation with our guest, obstetrician gynecologist Dr. Sonya Marks of Atlanta, and of course, documentarian Erica Taylor Davis and her wonderful piece of work, Red Alert. And I do believe we do have some folks who have questions. So Iron Flower Z on YouTube says, "Good evening, ladies. I'd like to ask how I select a care facility, fibroid center clinics, or a special GYN certified doctor." Good for you. Dr. Marks, what do you think?
Well, let's see. So, I mean, definitely, I'm sure there are databases that you can go to look for physicians that are specializing in specifically uterine fibroid treatment. But I mean, hopefully, if you're going to a board certified obstetrician gynecologist, they have, a fundamental understanding of fibroids and the management and treatment. So, locally, you can talk to, women that that love
Okay.
their
Okay.
obstetrician gynecologist.
So let's talk to a woman we know. Erica, what would you suggest for Iron Flower Z about finding the best facility or how one might start out looking?
Absolutely. Well, women ask me this question all the time. And one thing I want to say in reference to that question is when it comes to receiving fibroid treatment, for women who are currently seeing an OBGYN, one thing that I've discovered that a lot of us have in common is that when you talk to your OBGYN about your fibroids and how to treat them, a lot of times you're going to get a suggestion of a particular treatment that they may specialize in. So if you have a physician that specializes in invasive treatment, then there's a large possibility that they're going to suggest that you have that invasive treatment. That's been my experience, definitely. So the first thing I would suggest that you do is to research your treatments. So if you're looking into uterine fibroid embolization, there's several places that you can go. There is a nationwide chain called USA Fibroid Centers, and you can go check them out. They do offer uterine fibroid embolization. You can also ask your doctor.
Embolization, which is
It is. Embolization.
That's the
I'm
blockage
sorry.
of the blood vessels that feed
okay.
the fibroids.
Yeah, and embolization basically cuts off that blood supply and the fibroids shrink down into scars after some time. So that's a less invasive treatment, so that you can also ask your OBGYN about that currently. But also I'd like to refer to my colleagues who are in the fibroid awareness business. They have foundations specifically designed to have references and resources for women with fibroid tumors, and that's the White Dress Project. A soror of mine, Tanika Valbrun, excuse me. And she has a White Dress Project. It's a wonderful organization, and they have a lot of resources right available on their website. And also the Fibroid Foundation. These are both veteran organizations that pride themselves in giving women the tools and resources they need once they've been diagnosed with fibroids, and just to answer any questions that you have. But most importantly, I would tell you to Do your research. Definitely have some questions available for your physician before you go see them. They can feel free to reach out to me. I do offer offer women, the opportunity to ask me questions about the questions they need to ask their physicians as well. But definitely go armed with questions. So hopefully, that's enough to get her
Just
started.
started, yeah.
Yeah.
We do have other people who have questions, and so as we get ready to accept another question, I do have one. Do you think, Doctor and Erica, that the treatments are improving as a result of going to doctors or having doctors that look more like us?
I definitely think so, because we as Black women and Black women physicians, we know that this is a common issue in our community, and studies show that Black patients tend to fare better with Black physicians. And some of that is just because of having better foundations of trust where, the patient feels more comfortable relaying some of those symptoms that they may not, you know, feel as comfortable talking to someone else, or, feeling more comfortable asking the questions, to Erica's point, because, so there's a two-way relationship and trust and mutual respect that needs to be there, as far as, the patient, for them to feel comfortable asking you those type of questions, and to not feel like they're going to be dismissed or not taken seriously. So it has been shown to play a part in it.
Erica, do you feel that there's a comfort factor?
I do. There's just a layer of empathy that's needed between doctors and patients. That's definitely one of the reasons why I'm doing Red Alert, is to hope to bridge that communication gap that exists between the physician and the patient, the fibroid patient, especially the Black female fibroid patient. But there's that level of empathy that's needed that sometimes is more comforting coming from someone that may look like you, or may have similar family experiences as you. One of the things that we talk about is how we don't talk about menstrual cycles and issues with reproductive health in the Black community. So if you have a physician that can kind of understand that, or can kind of work with you on that on that misconception about what we should and shouldn't be talking about, it definitely helps. It helps to feel more comfortable talking about what's wrong, instead of just going to the doctor's office, letting them do the exam, and not having any questions, but just hoping to hightail it out of there, after
Right.
it's over.
Right.
So yeah, I really do think that definitely makes a difference. The women that I've spoken with specifically throughout this 3-year filming process, we do share a common feeling about the physicians that we see, and a lot of them that were offered hysterectomies early on, whether they're in their 20s, 30s, with or without children, or a significant other, they had white male gynecologists, or they had white gynecologists. So there's just something about seeing someone who you can relate to, that makes a bit of a difference in how you perceive and how you accept the treatment.
Right. Yeah, that does, it really does. I think that goes a long way in anything in terms of your physical health, and your mental health too, for that matter. We do have a comment, Yolanda. Charlotte Bowen Bellamy on Facebook says, my fibroids had me looking as if I was pregnant, and heavy bleeding, a lot of pain. I almost bled to death. My uterus was removed, was covered with fibroids. Quick action from my doctor at that time, and thank God for that. I don't think that's an uncommon situation, from what I'm hearing. And Erica, I don't know if you can speak from your experience in the documentary.
Yeah, absolutely. I mean, the first, shocker, but not shocker. The first fibroid surgery I had 18 fibroids removed. I'm sorry, 22 fibroids removed. And the second surgery, I had 18 fibroids removed. So when you talk about a uterus being covered with fibroids, fibroids in, out, all over the place, I definitely can speak from firsthand experience on that. So yeah, it's a very common situation for women to have those multiple fibroids, which goes back to what I was saying earlier about the physicians working to isolate that gene that makes those fibroids multiply, because for some reason or another, they love to just run in clusters. So it's not unusual. I had a conversation with actually my own OBGYN who is in the documentary. She is a fibroid specialist, but the largest fibroid, I think she said, I'm sorry, the most fibroids she removed out of one patient was overseas, and she removed 50 fibroids out of one uterus.
My Lord. Wow.
Yeah.
That's incredible. We're talking to Dr. Sonya Marks, who is an OBGYN obstetrician gynecologist in Atlanta, and Erica Taylor Davis, who is a documentarian and sharing her fibroid journey and her story in the documentary Red Alert, fighting the fight against fibroids. And Erica, how about success stories? Are we finding any in terms of conquering the battle against fibroids?
The success stories vary because each woman is different.
And
So
what does success look like to each person?
exactly. And so, when you think about in terms of success, I've got someone that, who is blessed us with her presence in the film, who had a hysterectomy. She didn't have any children. At one point she did, but she, believes that hysterectomy was the best decision that she ever made. So, so when you think about cases like that, she found happiness in that decision to have the hysterectomy, even though she wasn't offered the options that I think she should have been offered at the time. So then you've got someone else who decides, I'm going to go ahead and live my life despite the fact that I cannot conceive because of these fibroids and because of my reproductive health issues, and have found happiness in that respect as well. And also, most recently I spoke with a colleague of mine who got uterine fibroid embolization, and she had gone through years of struggle. She had fainted, in public before because of anemia, and, has to get frequent blood transfusions and iron injections, but she got UFE, and she feels like it's a decision that she wished she would have made years ago. And so, it just kind of varies when it comes to that level of happiness for each woman. We try to find a silver lining in all of it, no matter what basket you're handed. You try to find, try to make you try to make lemonade out of lemons.
Yeah. And sometimes the opposite direction too.
Exactly.
But I don't want to get into my dating life. So, doctor, let me ask you this. Do you find it, as Erica is saying, that it really does depend upon your perspective and in terms of what one deems as success in the treatment of this?
Absolutely. But, ideally, we want to catch patients earlier, before they get to the point that they're having those significant issues with symptoms with bleeding and pain, and to be able to intervene earlier to hopefully offer them, the lesser invasive, lesser complicated options for treatment. So, it's a mixed bag.
Got it.
Absolutely.
What we like to do is to end all of our shows on a lighter note, and not to say that you can't find lighter notes in the great documentary Red Alert, but I do want to ask each of you a question, and so our question of the day for each of you is: how do you find peace, or where do you find peace in your days, Doctor?
Well, I guess in the midst of this pandemic, I
Mm-hmm.
have started to exercise more. So, for the emotional and the physical benefits, I listen to music. I'm supposed to be reading more for enjoyment. I haven't actually started
Right.
that yet, though.
Right.
Um, I just try to take in just the simple pleasures of life at this point and find peace in that. I try to meditate more and do more mindfulness activities. So,
And
I
see, that's
definitely.
exactly what we're talking about, because in our partnership with the American Heart Association, we are concerned about your heart and doing your heart good, and finding those peaceful places, Erica, to reduce the stress and to find your peace. How about you?
It's something about that stress.
Yeah.
But I pray to alleviate stress. And that's something that happens, sometimes minute to minute, depending
Yeah.
on what I have going on in my life. But yeah, I definitely look above and look toward my spirituality to find peace. And I also find it within my girlfriends. Whenever I'm around my friends, and I know Sybil can attest to this, there's just a peace. There's just a familiarity that brings the stress level down to a minimum, where, you can express yourself. So anytime I'm around, my girlfriends, my close girlfriends, or anytime I'm in the spirit of the Lord, I'm happy. I'm at peace.
And we get a great deal of peace and fun watching Erica ask for special meals too. It's always a lot of
Yeah,
fun.
there's no fun being the only vegan in the group, I'm telling you.
We do want to close with our jewel, Yogi's Jewel, our daily inspiration, and that is to be the ambassador of positivity to your friends. And I think I'm talking to two friends here who are exactly that. I thank you all. Before we go, I'd like to remind you the American Heart Association is encouraging Black women to reclaim your rhythm and take control of your mental as well as your physical well-being. And Black women are empowered by the use of music. So my playlist has made it to the next round. And so thanks to you this time, I'm going to head with against Chef Daniel Thomas. He's a White House chef. But his music may not be as good as my playlist. I'm just saying. Vote today until 10 o'clock Central Time tomorrow, 10 a.m. Central Time. Cast your vote by going to @American_Heart Stories. Hope you like mine, and I'd appreciate your vote. Thanks, everybody. We appreciate it. Thank you, Dr. Marks. Thank you, Dr. Erica Taylor. And Red Alert, how can people find it?
Red Alert, you can go to redalertmovie.com. Such a simple domain, redalertmovie.com, where you can view the trailer in its entirety. We are also Red Alert Movie on Instagram, Fibroid Movie on Twitter, and Red Alert Movie on Facebook. So please feel free to check us out.
Bye, everybody. Thank you.
Bye.